Dr. Narula is here to tell us all about it. Great to see you, Dr. Narula. So this drug is called Addyi. It's been on the market for a while, but the FDA has just approved it for something new.
Correct, yes. So this was approved in 2015, Addyi. It is a drug for hypoactive sexual desire disorder. It was approved in 2015 for pre-menopausal women. Now they have expanded the approval to postmenopausal women under the age of 65. Now this, as you mentioned, is the first drug for postmenopausal women for low libido. It was approved in Canada in 2021, and that kind of paved the way for what we're seeing here now. By changing the chemistry in the brain, it was actually initially looked at as a mood or kind of an antidepressant drug. So it increases levels of dopamine and norepinephrine in the brain and lowers serotonin, and that is essentially how they believe it works to help increase that desire or libido.
And this is pretty prevalent. 1 in 8 postmenopausal women are experiencing low libido. How should women talk to their doctors about this? How should they know if this might be something for them?
Right. Well, we want to kind of differentiate between generally low libido and hypoactive sexual desire disorder. And that meets, you have to meet certain criteria. So essentially it is defined by a sense or lack of desire for sexual activity, a decrease in sexual thoughts or fantasies that actually causes personal distress and interpersonal difficulties. So you would meet with a doctor, they would rule out any underlying medical conditions, mental health conditions, medications that might be causing it, and then they would take a sexual health history and give you a screening test that would basically help decide if you really meet that criteria. And if you do, then there are treatments, things like therapy, counseling, treating any underlying medical conditions, and then medications. There is actually one other drug available since 2019 that's an injection for premenopausal women with hypoactive sexual desire disorder.
An injection.
Yes.
So a pill is a very different kind of delivery mechanism. People might be more inclined to take that.
Exactly, yes.
And the conversation around menopause now, suddenly, we are always talking about this now. It is something that we actually are speaking about again.
Finally, and it's so important because we want women in that phase of life to feel comfortable talking about the many symptoms they may develop, and also specifically sexual health, right? There shouldn't be any taboo or shame around discussing this with your doctor. As we mentioned, there are treatments. We've talked a lot recently about hormone replacement therapy, which can help some women with this, but it's nice to have another option. Again, go to menopause.org. You can find a certified menopause practitioner in your area by your zip code.
Great information, Dr. Narula, as always. Thank you. All right, after the break, Robin Arzone and Jess Sims are